Hello guys, this is Dr. Pal Manikam. This is a very special video because we are going to try a new format of reacting to medical memes which you have sent me. So I'm going to react to it and then see what is my experience in it, and then we're going to have a huge fun in this video. Let's dive deep into it. First year medical students, finally a doctor after 15 years. I can totally relate to it because I joined medical college in 2000. By the time I finished my medical college, MBBS, MD General Medicine, AB Gastro and MPH, it was 2015. So it was 15 years. Almost I felt like, I was studying medicine when dinosaurs were roaming around the house, and I finished medicine when Gen Z came into earth. My patient Arvika Sami is saying, at least Amir Khan movies will collect a lot more than a doctor. Doctors have gone on strike, but their demands are unclear. They're talking about the handwriting. No one can clear NEET if there are marks for handwriting. See, if my handwriting is clear, my patient is asking for my medical certificate. See, things are changing now because everything is getting translated into electronic medical record. I strongly feel that every patient who's getting a prescription should actually know what kind of medication has been given, because it should be an informed decision. Since the electronic medical record is being slowly introduced here in India as well, there is a bigger problem where the patient-doctor relationship might be strained because doctors will not have enough time to spend with the patient. That is exactly what is happening in the United States. There should be a fine line. Medical symbols. What is this? Pediatrics. The snake could have worn a diaper too. Anesthesiology. Oh, the snake is drowsy. Looks like the snake just drank a peg of Johnny Walker. Cosmetic dermatology. Die. What is this, Ra? Where is the snake skin, Ra? You forgot to cover? I think we should change the setting of this video to 18+. Orthopedics. The snake is being tied to the thing. Reminds me of Basha Rajini being hit by tying him to the lamppost. You remember the song? Peace, peace, kilikkum podu Yesu madri sirikira paru. Something similar to that. Dentist. Okay, what is happening? Oh, snake is smiling. Is it snake without tooth or full of teeth? Either way, it is full filling. Okay, what is next? Radiology. Oh, X-ray of the snake. It looks like the plastic train track now my kids are playing with. Gastroenterology. Okay, what have they done? My department, Ra. What have you done, Ra? It looks like a worm used as a fish bait to catch fish, but they have translated the endoscopy, putting a scope down the throat. Okay, obstetrics. Obstetrics, the snake, actually their point was to make the snake look like it is pregnant, but it looked like as if it just had a crocodile tandoori. Okay, ophthalmology. Oh, the eyes are very prominent. So only the spectacles are missing. Definitely this snake needs a LASIK surgery. Okay, cardiology. What is this, Ra? Oh, the snake is having zigzag movement. Oh, it is bypassing the nail. Bypassing the nail, cardiology. Oh my god. Overall, these meme creators have nailed it. Okay, beautiful. Problems in your personal life, choose a medical career. No personal life, no problems. ஏண்டா உங்களுக்கு நியாயம் இல்லையா?
அத வேற ஞாபகப்படுத்திட்டீங்க. நெஞ்சமெல்லாம் பொண்ணு அறக்கு தம்பி. மறக்க முடியல.
Sometimes they are right, because we will not have a personal life at all if you are a doctor who is not focusing on work-life balance. I'm going to be very honest here. In United States, the work-life balance is slightly better because we have better coverage. When we are doing duty from 7 a.m. to 7 p.m., at least we go home at 7 p.m. Somebody else is taking care of our patients after 7 p.m. Unfortunately, that practice has not been caught up in Indian practice yet. I am really hoping that all the doctors practicing in India should really compromise their work-life balance. If not, we will not be keep on providing service to the patients. We need to prioritize our health first. Then doctors were like Mr. Bean. Only friend is the teddy. They lead a lonely life, but their patients were happier. They were Arjun Teddy. Now, the patients have become Arjun Reddy. Not only personal life, don't worry about the regular practice. There are lots of problems because they are hitting the doctor itself. If the patient is not getting better, the initial reaction of the family is actually to hit the doctor, which is getting very, very common these days. This needs to be strictly condemned. You know that feeling when you meet someone and your heart skips a beat? Yeah, that's arrhythmia. You can die from that. Yes, you can die from an arrhythmia, maybe probably not just with skipping a beat, but arrhythmias can be dangerous. Arrhythmias is a condition where your heart doesn't beat properly in line with the synchronization. So when your heart beats, I won't explain about this. There are 4 chambers. The upper chambers contract, push the blood into the ventricles, which is the lower chambers. Then the blood from the lower chamber contract and the blood goes to all parts of the body. So this is a beautiful synchronized rhythm. Even when heart misses a beat, this flow will not be proper. And that's why when there is an arrhythmia, when the blood doesn't go from the lower chambers to all parts of the body, you can get syncope where you can actually fall down or you can lose your consciousness as well. So it is very important your heart beats properly. He's the person who says, I will even die for you. He doesn't live up to the word, he actually dies up to the word. And all these pickup lines needs to be even monitored more carefully because people say that I can't eat without you because this guy might have gastroesophageal reflux disease. And if a pickup line says that, oh, I can't sleep without you, please check because you might have insomnia.
Emotional damage.
Club isn't the best place to find a lover, so the dissection hall is where I go. So the meme creator has cut the wrong lines of the song. It says, I'm in love with the shape of you. It should be, I'm in love with the shape of the body. Club and dissection hall is almost the same because usually people faint and fall in love with the cadaver. The only difference is in the club, it is alcohol. In the cadaver, it is formalin. I still remember my first day where I was in the dissection hall. Actually, I was the only student who came right on time and they said to wait in the anatomy hall. I thought it was a lecture hall, it was a dissection hall. The only people who were giving me company was the 12 dead bodies in the cadaver. Being sad after getting 90% in the 10th and 12th board. Okay, and then Avesham guy, what is he doing? He's being happy for getting just passed an MBBS exam. You know, this is totally true because after 12th, we lose our Avesham to study, energy, right? Either doctors spend time with their friend Amban, who they find in the college, or dance for Karina Lele song with their girlfriend that they find in the college. In my opinion, you cannot trust the doctor with the marks alone because I've seen many people who claim distinction during their medical college, but they will not have the practical knowledge to apply to that particular patient. Even if a doctor just have a pass score in the exam, they'll be super duper doctors where they'll be able to translate the knowledge practically. So it'll all come down to actual patient treatment and not in the marks, especially in medical college. When you are over 50 and they say put a band-aid on where it hurts. They put a band-aid on the whole body. It looks like pillow and blanket given for senior citizens in a reserved seat. Hey, it's not band-aid, it's blanket aid. At least I'm feeling happy that the left hand, right hand fingers and below the knee are functioning. More importantly, they still have the hairline, no hair fall. So it's very important that you put your effort in the first 40-50 years of life because that is your long-term investment. Every year after 40 or 50 years is exactly dependent upon how much amount of effort that you put in for your health in the first 40 years. It's very, very critical. So if you're between 25 to 40 years of age, this is absolutely critical to maintain your health, especially your gut health. Remember, 1 fruit and 1 vegetable every meal. Giving up years of my life to add years to yours. Wow. Very powerful. So as a doctor, we usually spend more than 10 years of life to get the expertise and then pass on the information to the patients. So it is very important that we understand that should be a patient-physician relationship. People work hard to provide the care to the patient, and nowadays I strongly believe that the trust has been broken at multiple levels, not only from the patient angle but also from the physician angle. Either it could be overwork or it could be a lack of complete attention or the patient is expecting too much from the provider. So either ways, it needs to be a fine balance. It's like a marriage. If not, nobody will choose a doctor's profession and people will be requiring doctors' help significantly. This is a problem that we need to solve right now. My friend Sarana Kumar is thankful to Google and ChatGPT than doctors. He says, you don't even pick up my call, but they show immediate results. Relax, David. It's just a small surgery. Don't panic. My name is not David. Patient is saying, I know, I am David. The surgeon is talking to himself. But this is actually, we wear a mask because our words doesn't come out. Hey, David, if I was a patient, I would have sweat like cricketer dra. This is a very dangerous situation. Before going to any surgery, we get the consent from the patient explaining the risk and benefits of the procedure. So it is absolutely important for you to understand the risk of any kind of procedure as well. Just don't sign the agreement form or the consent form without understanding what is the risk, because it needs to be an informed consent. Any procedure, any kind of medical instrumentation in your body will carry a risk. You need to understand whether the risk is worth the benefit or not, and that is why a detailed conversation is absolutely critical. So I had fun reacting to these medical memes. If you have any of these medical memes, please send it to me as well. We would be happy to analyze and then react for you. Hopefully you have learned a little bit about my personal experience and also some kind of medical information from this video. I will see you in the next video. Until then, remember, one belly at a time. It is absolutely important. Stay happy, stay gutsy. May God bless you.